Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about ultrasound for chemodenervation of the biceps and brachialis, which is important when it comes to addressing elbow flexor spasticity. So when we orient the ultrasound probe for targeting the biceps, we want to have the ultrasound in a transverse plane approximately around the mid-arm, so as shown here in this image. And then if we look at the ultrasound, on my left or medially, we have the brachial vessels, and then to my right radially, we have the humerus. Once you've identified these structures, then you can sort of use them to find the biceps and the brachialis. And so here I am moving the probe medially, now laterally, and I'm trying to distinguish where the biceps is. And what I'm going to do here is supination and pronation. And you see that muscle belly that's moving on the top, the biceps above, the brachialis below. And again, I'm going to show it here. Again, the biceps supinates, whereas the brachialis doesn't, so that movement allows you to distinguish between the two muscles. So if I wanted to inject, I could use an out-of-plane approach approximately here to target the biceps. And I prefer the out-of-plane approach because it minimizes the needle depth. So the biceps, the innervation is C5, C6 myotome. Peripheral nerve is the musculocutaneous nerve. As mentioned, it's an elbow flexor, so it can contribute to elbow flexor spasticity. It does supinate the forearm, which you can use to distinguish the biceps versus the brachialis on ultrasound. You do have to be careful because if you do weaken it with toxin, there is the potential to worsen forearm pronation positioning. Again, we talked about the landmark and the dosage of toxin, 20 to 80 units for Xeomin and Botox, and then approximately 3 times that for Dysport, so roughly around 60 to 300 units. So again, that biceps, the important thing there is the forearm supination. Then if we look at the brachialis, what you should do is move that probe from the mid-arm down a little bit more distally, just above the elbow crease, as shown here. And then if we match that up on the ultrasound, it'll look something like this. So again, the brachial vessel, and then the humerus there on the right or more laterally. And then as I go down, what you'll see is the biceps there that I'm supinating is becoming smaller and smaller with the brachialis underneath it. So again, we go back to the live version here, again, supinating that biceps muscle, and you see that large bulk of the brachialis underneath. And so if I wanted to target this with toxin, I could use an in-plane technique, bringing the needle in from the lateral aspect, which would sort of come on the right of the screen here to get that brachialis muscle. And so if we again review the brachialis, the innervation is the C5 to C6 myotome. Peripherally, it's innervated by the musculocutaneous nerve. Its function is an elbow flexor, so we can target it for elbow flexor spasticity. It does not supinate the arm, so again, that allows you to distinguish where it is versus the biceps under ultrasound. Again, because it doesn't supinate the arm, targeting the brachialis can be quite important for elbow flexor spasticity because it will not worsen a forearm pronation positioning, which we can often see in individuals who have sort of upper motor neuron pattern weakness. The landmark, if you use the textbooks, is 2 finger breadths proximal to the elbow crease and just lateral to the tendon and the muscle bulk of the biceps. And then the dosage, Xeomin and Botox, would be 20 to 60 units, and then Dysport would be roughly 3 times that. So I'm the neuromuscular mechanic, and I hope you found today's episode handy.